So I am talking today to Lloyd Pinnock Brown, who is the co-coordinator of Granville Food and Fellowship Food Bank and Soup Kitchen. Lloyd, thank you so much for agreeing to be interviewed for our CIHR-funded COVID-19 Stigma Reduction Study. Welcome to our study, the work we're doing, and looking forward to discussing with you the work that you are doing with Granville Food and Fellowship. So Lloyd,
very nice to be here. Thank you for inviting me. I really do appreciate you taking the time to meet with me. So thank you so much, Lisa.
Thank you. I'll start by asking you, Loy, about the work of the Soup Kitchen and Food Bank and the communities that they serve. Like, what kind of role do they play in meeting the needs of those in the community?
Thank you so much for the question. So this Granville Food and Fellowship Food Bank and Soup Kitchen was birthed out of our church, which is Grant Amy Church in Toronto. And the church has been in Toronto since 1833, and I've always had a mission to help those in need. But in 2016, myself and Keith Alexander was put on our hearts to offer a soup kitchen style option for those in need in our community. And so we started out with about 40 people once a month, and we would offer soup and sandwiches, fellowship, conversation, and just an opportunity to give them things that they need in the community. But now it has evolved into an official food bank, and we are an agency of the Daily Bread Food Bank and Second Harvest. And we currently serve 400 people per week, every single week, with food supplies for them to access the food bank. All are welcome. Everyone is welcome to come and be served in the food bank, which helps to remove any food insecurity and offer those in need in the community healthy options of food. And it really is a food stopgap to provide for them for 3 or 4 days for that week. Since the federal government does not provide official food support or money for food, it is really up to community organizations and faith-based organizations to help fill that gap and offer food to those in need in our community.
I see. So you started off with 40, and now you say you serve 400 people, which
Every
is
week.
every week, which is quite a substantial growth over that time, right? In terms of the communities that you are serving, you said all are welcome. Are there particular communities, or is it based in a particular location? Like, how do people hear about the food bank and the soup kitchen?
Okay, so we are currently at Woodbine and Girard, so the Upper Beaches area. And again, all are welcome. So a lot of our awareness comes from word of mouth. And so it's those that in the community that share with others in the community. We also access social media. We have Facebook and Twitter. And we also are in publications, local publications. We're in 211. We are, as I said, members of agencies of the Food Bank, Daily Bread Food Bank, and Second Harvest. So we're listed as resources with them as well. But one of the biggest way that people know about us is word of mouth, people sharing, and people come from all over the city, some as far as Rexdale and north, even more north than that, Mississauga, because they know it's a welcoming area, that we're generous as much as we can, and we provide for anyone in need. So we also provide emergency food. So if people even access the food bank that week but are still in need, we will provide for that need as well. So word of mouth has been the biggest draw for people knowing about our food bank.
Wow, that's amazing. And in terms of you say word of mouth, and is there a particular profile of people who use the food bank? Is there a particular age group? Is there a particular race, ethnicity? Or is it just a diverse range of people who access the food bank?
Well, I would say it is diverse because we welcome all, but we do have Asians and white and black and Middle Eastern and brown people that access the food bank. We did find at one point that we were looking to see how we could help bring more people with brown and black people into the food bank to access it. Because one of the issues we find, especially in the Black community, where there is a pride about accessing food banks, and so we made steps to actually reach out to those communities to let them know we're here and we're here for them. And we did see an increase in those groups that are coming into the food bank more and more. So we do have mainly older persons. We do have some families, lots of families that come. We service about 40 families, and the rest are between 1 and 2 and 3 people. Families we consider 4 plus.
Right.
But mainly our clientele is between 1 and 3 people, and about 30% is larger families, 4 plus. But we are actively trying to draw those that we know are in need because of marginalized communities that oftentimes are underserved, trying to draw them in as well, letting them know that we are here. Because our church is mainly a Black congregation. So we wanted to make sure that those Black persons in our community know that we were there for them as well. And so we made extra efforts to draw them in and let them know that we are here to support them.
Yeah, and just to pick up on something that you mentioned, you said, in terms of you're trying to serve, your Black community, Black fellowship through your church and drawing them in, but you mentioned, probably because of pride. So there, there's a certain stigma, there could be a certain stigma attached with accessing
Mhm.
food bank and soup kitchens as well, right? Which is one of the
Absolutely.
problems you've talked about overcoming in trying. There
Mhm.
is the need, but there is also the stigma which may
That's right.
prevent people from accessing these services.
That is absolutely right. And we do provide a very warm and welcoming environment. So once they do come, they definitely do come back because of the atmosphere that we provide. And we are there to provide for all of their types of needs, whether it is just food or hygiene or meal replacements, liquid meal replacements. We try to provide those items for them as well, diapers and other items, so that the whole family can be served. So we did take extra efforts to do that, and it did provide more clientels from those groups coming in, and brown communities as well. They are welcome, and we are finding a lot more of those in that community are being serviced in our food banks.
Wonderful. So, Lloyd, how has the COVID-19 pandemic impacted the communities you serve?
Oh my, it has been such a huge impact. One, there are more people accessing the food bank. We have seen a 40% increase
Wow.
in clientele over the year and a half of COVID. We have seen people that are first time food bank users, a lot who you would never think would be at a food bank. One of the community members stopped by to say, I saw my neighbors in the line for the food bank and I had no idea. And so it just talks to the conditions that COVID-19 has really put us in, this pandemic, where there is such a great need now. As I shared with you, we're up to about 400 people a week because of the need in our community. So the increase in the need for the food is definitely a factor that COVID-19. Also, the it has really impressed upon us, how do we serve people in our community and be safe at the same time.
Yes.
So we really had to look at that. A lot of the food banks in our area closed and never opened. And so we were one of the few in our area that only took 1 week off. Even during this last 18 months, only 1 week, we took off to strategize, to organize and determine how do we do this safely. And so we had to move outside the building. So instead of serving inside, we served the clients outside the building.
And
So
this was
there'd be
even,
lineups.
this included winter as well. Like during the winter, you would be serving
Yes,
outside.
yes. So we served outside right up until the fall, winter. And then we devised a delivery system so that we could still provide food to our clients in a safe way, a touchless way, without having them to come out in the winter conditions, because a lot of our clients have mobility issues as well. And to serve them outside in the freezing cold would have been difficult on them. So we increased our delivery system. So we would have 5 to 10 drivers come every week, and we still are doing this. And they would take 1 or 2 routes, and then they would deliver food boxes to the clients on this route. And that has been very successful. So we reduce the amount of people that have to come in and walk into the space. Now we've come back as of May 7th, we've come back into the building in a safe way, but we are also providing the delivery system. And I just have to take a moment to talk about our volunteers.
Yes, I was going to ask you, is it purely through volunteers that you do the delivery system?
It is purely a volunteer-based system. No one is paid. We are all there. They have sacrificed their time, their strength, even their safety to come
Absolutely.
and be a part of this food bank for the whole time. Not one volunteer has denied coming or helping in certain ways. We have at-home volunteers as well. But our main volunteers have come week after week after week. But we have devised a safety system. Now that we're inside, we have fiberglass screens. We have a temperature checks. We have mask checks. We have contact tracing sheets, all of that to keep both the volunteers and the clients safe. And we provide masks and gloves and sanitizers to those in need in the community. And we couldn't do that without generous donors, both community neighbors that have stepped up and say, how can I help? Along with organizations that have provided help as well. So we are grateful for our volunteers, for our donors, for those who thought that they would sacrifice themselves to help someone else. So we're grateful, very, very
Absolutely.
grateful.
That's amazing, especially when people are, scared about safety,
Right,
especially during a pandemic, that you were able to continue when so many, as you said, so many other soup kitchens and food banks closed during this time. I wanted to pick up
that's
on
right.
something that you said, that you saw people, using food banks for the first time that you would not typically have seen using a food bank. Can you tell us more about those groups of people? Like, would that be families? Are these individuals? Are these people who may have lost their jobs? Like what,
Absolutely.
what brought them to the food bank?
Absolutely. I think it's a combination of all of those, Lisa. People that have never accessed a food bank because now they have lost their jobs, that they're furloughed, that they're on the government assistance programs. So they would come and feel insecure about coming, but also in need of food. So we would make them feel comfortable and let them know that whatever they need, we would try and help them with it. And so there was one time where there was a driver who was driving for us and dropped off a food box. And they said when they arrived at the house was big and it was beautiful.
Mhm.
And it's like, why are they in need? And we really shared with the driver that you can't judge. We can't
Absolutely.
judge. We
Yeah.
are not there to judge.
Yeah.
If they say they're in need, they're not going to come to a food bank for a status symbol. They're going to come because they need. So we have to look past that and provide the need. And so we're grateful, and we don't look as to why. We just look that they are in need, so we are going to provide whatever they need.
So circumstances from just this story, this anecdotal story that you're sharing with us, circumstances have definitely changed during the pandemic, whereas before,
Absolutely.
someone, yeah, you're looking at someone with a large house may have changed, their circumstances have clearly changed and therefore need to
Mhm.
access the food bank. And this comes back to your strategy of helping people overcome stigma to access the services that they need and the resources that they need in terms of food insecurity, right?
That's right. That's right.
So my other question, Loy, is do you think race and/or ethnicity play a role in the communities who need to make use of soup kitchens and food banks?
Absolutely. So, as you mentioned, there is a stigma that surrounds accessing a food bank that may hold people back from getting the help that they need. And so, there is a need to overcome that stigma and let them know that we are there for them and that they don't have to suffer alone, that we are in it to support them.
Mhm.
And also, just the resources. People of marginalized people may not understand the resources that are out there for them and how to access those resources. And so it's important to fill that gap, to share that information with marginalized communities so that they can have access, free and open access to the food that they need. And so that is really important that we see that we can help with, is to overcome that stigma, overcome the lack of resources, to let them know that we are there to support them in whatever they need. And they keep coming back. So it's really just a matter of educating them.
Right.
And once they're educated, then they will access the services that are there for them to access. And so I'm grateful that we are there for them.
Yes, so members of racialized communities are more likely to experience inequitable living and working conditions that make them more vulnerable to COVID-19 and the impacts of COVID-19 in terms of, low earnings and incomes, unstable employment, precarious housing, limited access to social services and health services. Do you think, the pandemic has disproportionately impacted members of our racialized communities? And have you seen that in terms of the work that you are doing with the food bank and soup kitchens?
Absolutely. So COVID-19 has really forced a lot of people out of work. As you said, stable work is not something that the community that's already disenfranchised have access to. And so COVID-19 has made everything a little worse in regards to access, both to good paying jobs and to jobs period, as well as food banks closing all over. So having to go further to access food banks. And so we have to recognize that this is affecting some communities more than others and take steps to overcome that and to also be a resource. We found that periodically every 3 months, we would send out resource materials as to where to access certain things, whether it was job training or during the tax season, we would offer resources for free income tax um, uh, application assistance. And so those type of things, you have to make efforts, special efforts to meet the needs of those that are more affected by these conditions. And so that's what we try to do, is to assist wherever we can with that resource, with that information, with access, because it's all about access. And
Absolutely.
so
Yeah.
it is something we try to do.
And those resources that you're talking about, so some of them you've talked about the delivery service, offering contactless delivery of food, in terms of tax services and resources that people may find problems accessing, would that be done online? Like how did you do that over the past year with the pandemic?
Well, as I said, we would send out flyers with our delivery service or with the walk-ins that would offer that type of services, where to contact
Hmm.
on a resource sheet. So we would have everything all in one place, where to contact for what, so that we would be a resource center or tool that they could access the information. And so I think it's important for us to recognize it's not just about food. It is about helping where they are to improve their life. And so we did that every quarter. We would send out some resource information for them to have access, either by phone or by email or websites, so that they can have access. We also found that some of the clients don't have phones. Some were homeless. And so those were challenging as well. We would give them addresses where they could go and access some of those services as well. But we have to meet them where they are and try to find ways to help.
Well, that's a really important point, and I'm glad you brought that up. That some of your clients are actually, they are homeless. So how do you meet their needs, right? Especially during a pandemic, which would have posed particular challenges in trying to keep your volunteers and staff safe, as well as trying to fulfill this needs that's out there, not just in terms of food, but other resources that you can bring to people who are homeless, who are living on the streets, who precarious housing, precarious life.
Absolutely. And it's about asking them what their needs are, because some of our clients are in rooming houses that don't have access to kitchens. So they would only need ready to eat food. Some of our clients were homeless and living in parks. So they would only need a meal. And some of our clients were unable to cook because of their medical conditions. So it is hard to meet everybody's needs, but we do try to see what those needs are and how we can best help them. And so it's really giving them the dignity that they are individuals that have individual needs, and trying to meet their needs wherever they're at.
And this brings me to an important point in terms of the pandemic, in terms of health, because we talk about health, but the social determinants of health are not just about physical health, right? It's exactly what you're talking about. It's both social and economic factors which determine a person's, their broad determinants of health and a person's place in society. And as you just talked about, bringing them the dignity that they need to access services as basic as food, but other resources that you've been able to provide. In terms of, you talked about some of your clients, some of the people who accessed your soup kitchen and food bank being homeless. So would your volunteers actually go out to the parks to drop off food for those people in your community?
Yes, so we have a every year we do have an outreach where we go out to the streets and we provide both food and essential items such as socks and underwear, and sometimes it's soap and toothpaste and toothbrushes. So we would get together with those in our community, and last time we went out, we serviced over 200 persons, where we would provide both a male or female personal care kit, as well as sandwiches and snacks and drinks. And we've had soup on the corner, or any hot food item as well, recognizing that they may not have access to hot food. So we do have a street ministry where we do go out into the community as well, where we will do those type of provide those type of services, because we recognize that not everyone can come to us. Sometimes we have to go to them. And so that's what we try to do as well. So, and still remaining safe, but recognizing that even during this pandemic, where everybody is affected by this, we do have to go and meet them where they're at, taking safety precautions in mind, but also just trusting God to help meet their needs. I remember last time we went out to the streets, there was a lady that had no shoes on, and this was in the winter. And so we were able to give her some shoes, and she put them on right away. And so it's to meet whatever needs there are and to help those in our community that are in need in whatever way we can.
Absolutely. So, Loy, I believe you said that you started this vision, came to start the soup kitchen and food bank in 2006. I think that's
16.
2016. Yeah, 2016, and we are now in 2021. What has surprised you in all the work that you've been doing around this? What has surprised you? What really stands out in terms of the work that you've done and the people that you are serving?
For me, what stands out the most is the gratitude. It's people just being grateful for the help, for whatever little help that we can provide. They are so grateful and so appreciative to know that we are there to help them. And that warms my heart every week, just to see the smile on their face, the gratefulness in their heart, and also that people are willing to help and to step up as long as they know that there is a need. And so I'm grateful for friends, for neighbors around our food bank who have stepped up and say, what can I do to help? Drivers come from the community. And so it's community members that see what we're doing and have offered to help. And I do have to mention that even though COVID-19 has been devastating in our community, we have had some COVID-19 blessings, I call them. Because we have
Tell
been
me about your COVID-19 blessings.
because we have been pushed outside of our church to serve our community, we're more visible. So neighbors would drive by and see the work that we're doing. It's not inside anymore, it's outside. And so they have been pushed to come and help because of that visibility on the outside. And we've received donations. People came in off the street with a $2,000 donation. Wow. Because they see the help that we need. And so I consider those COVID-19 blessings.
The power of humanity.
We have received, absolutely. And people just need to know what the needs are. And if you can express the needs, then I believe that people open their heart to help. And so we are grateful for that. So those are some of the COVID-19 blessings that we have received throughout this pandemic period. But we can always use more. I think one of your questions that you may get to is assistance.
Yes, that's coming to my last question to wrap, just to wrap up this wonderful discussion we're having. In terms of what kind of changes would you like to see implemented and resources made available to help organizations such as yours and communities you serve improve the lives and situation of marginalized people?
Mm-hmm. One of the things I would like to see on the federal level is to make food insecurity a major issue, where that they will eliminate all food insecurities in our communities. So that would mean putting money behind that effort, that they would support federally the food banks that are in the city and in the country, recognizing that there is a need and supporting that need financially. So that's what I would like to see is federal support for food services for those in need in the community. And I think that is something that we can all push for have a voice to change, both with our local councilors, our MPPs, our MPs, and of course the Prime Minister, is to make that a priority to avoid food insecurities in our communities. So that's one thing I would like to see more support from our federal government.
I think that's a great point.
Lisa?
Yes, yes, I'm still here.
Mhm.
Yes, and I think that's an excellent point. And certainly, I think the pandemic has highlighted, just how precarious people's lives are, especially around food insecurity. You have seen, a huge increase in the numbers that you are serving. And if so many of the other food banks and soup kitchens have closed during this critical time, yes, those people may be able to come to your food bank and your organization to access services, but not everyone has been able to. So what's happening to those people, right? So I think that's a great point, to summarize when we talk about the disproportionate impacts of COVID in terms of marginalized people, that pressure needs to be applied, as you said, to the federal government to work with organizations like yours, to put money and resources into these organizations so that we can work towards eliminating food security for our communities.
I agree with you 100%. I can share with you that we are in such need of certain items. Week to week, I cannot provide items to all of our families. For example, eggs. I don't have enough money to provide eggs and meat and diapers every single week. So we have to pick each week who gets what,
Right.
because we don't have enough.
Yeah.
Baby food, liquid meal replacements. We just don't have enough money to supply those every single week. And so we have to make hard choices sometimes. This group will get this week, the walk-ins, or the deliveries will get this week. And we'll skip a week, and it's every other week that we'll have one group get, and then the next week we'll get the other group with eggs or whatever it is. And that's a shame that we have to do that. But that's the truth of our situation, that we do have to choose who gets what every week. We don't have enough for everybody every week, and we should.
Absolutely, no one should go in want of basic food,
Exactly.
and your organization such as yours should not have to make these very difficult trade-offs in terms of, giving people essential foods and what family gets fed this week as opposed to next week, right?
That's right. That's right.
Very difficult trade-offs. Loy, it's
Mhm.
been an absolute pleasure talking to you about the work that you're doing at Granville Food and Fellowship Food Bank and Soup Kitchen. I thank you for your time today and all these important insights that you have shared with us.
Thank you for making this a priority, Lisa, to talk about food insecurity and how it affects marginalized communities and what we can do to make it better for those in need in our community, and helping to raise the issue so that others will be aware of the needs, and hopefully they can too come alongside those organizations that are helping to fill that need and to satisfy all the needs in the community.
Absolutely. That's a great ending for this conversation with you. Thank you, Loy.
No problem at all.